here is your station.
Yes, ma'am.
All right. You want to, all right. Okay. If you have read and understood, considering it surgical pathology
Yes.
station, please tell me. Right. You've read the stem and please tell me what would you answer to the patient?
As the patient has undergone uh, surgical resection of the gallbladder, and it's her fourth postoperative day.
Yes.
She might have developed surgical site infection after cholecystectomy, and as she might have been given antibiotics to avoid infection for her wound. That is the reason she might have developed pseudomembranous colitis.
What is the most common organism which occurs as a surgical site infection?
Staph aureus is the most common organism which causes surgical wound infection.
Okay, just suppose it was operated or the gallbladder carcinoma. So what is the most common gallbladder carcinoma that occurs in UK?
The most important carcinoma, the most common carcinoma of the gallbladder which occurs in UK is adenocarcinoma.
Yes. And what are the most common causes that occurs in UK, United Kingdom, that leads to the
There
cause
are
of gallbladder?
there are a few risk factors. For example, obesity, gallstones,
Yes,
gallbladder polyps,
yes. Okay. What is the
more than
most
1 centimeter.
Yes, what is the most commonly occurring site where this gallbladder carcinoma spreads to?
The most common site for the gallbladder carcinoma where it spreads is uh, mm, uh,
By
is the
direct
liver.
by direct invasion, yes, to the
By
liver.
direct invasion is liver, and the most common sites are segments 4 and 5 and local lymph nodes.
Talking about the lymph node, please tell me the lymphatic drainage of the gallbladder.
The lymphatic drainage of the gallbladder is to porta hepatis,
No.
lymph
First,
node,
cystic node, then
then porta hepatis.
pericol pericholedocal nodes, and then to the regional nodes, and after that, aortocaval nodes. Right. What are the risk factors which leads to the formation of gallbladder?
Stones
Sorry, what are the
for
risk
the
factors? Yes.
for gallbladder stones.
Yes, but the risk factors are age greater than 70 years, female gender, family history, ethnicity like Mexicans, Native Americans. There could be smoking. Okay, one of them is gallstones
And porcelain gallbladder
yes, and
and gallbladder polyp more than one
yes,
centimeter,
very good. And
obesity,
okay, and chronic infection by staph Typhus.
Yes, chronic cholecystitis.
Yeah, or it's colidocal cyst. Okay. Right. What is pseudomembranous colitis? How it occurs? Patient was given.
Pseudomembranous colitis. It
It's a side effect.
results.
Yes.
It results after the antibiotics. After the antibiotics disrupt the normal flora of the colon, and pseudomembranous and Clostridium difficile bacteria overcomes the normal flora of the gut, and it disrupts the epithelium. Moreover, it releases these bacteria release toxins,
Okay.
and
Enterotoxins. Yes.
these toxins these toxins cause diarrhea.
Yes. Before that, these exudative fibrin depositions. So the mechanism, 2-3 bits, important bits are skipped.
Sorry, I just
Okay.
forgot about that.
Right. All right. Okay. How would you manage this patient further?
I will manage this patient by giving intravenous fluids, anti-diarrhea drugs, and intravenous antibiotics.
All right. Which antibiotics?
Antibiotics after getting culture and sensitivity result, and following the trust protocol,
Okay.
and
Following the
discussing with
first.
microbiologists.
If you'll take abdominal X-ray at this point, what do you expect to see?
In the abdominal X-ray,
There is a typical, yes. Have you heard of thumb printing?
thumb printing sign.
Yes. All right. What more investigations would you go for?
I would like to go a few blood investigations, like full blood count, to see white cell count levels, and stool examination, and rigid sigmoidoscopy.
Okay, please tell me what would be the indications that you would operate on the patient again?
For gallbladder cancer,
That has already been done. Now you would want to manage the patient, or what would you do next? Like
if there is a possibility for surgical site infection,
yes.
I would like to open the wound and take swab.
Yes.
From the discharge.
Yes.
I will further wash the wound and
Yes.
allow the wounds to be drained.
Okay. Would you leave the wound open?
I will leave the wound open, and I will commence giving this patient antibiotics.
Okay. Right. What would you do to manage the diarrhea of the patient?
I will give the patient according to the severity level. If the patient is not dehydrated, I will ask the patient to take plenty of oral fluids, antidiarrheal drugs, and
Which antidiarrheal drug?
antispasm.
Okay. Thank you.